Hello and welcome everyone to this month's Journal Club. I'm Harriet, one of the members of the IMV clinical team, and for those that haven't met me before, I graduated from Liverpool in 2017. I've worked in mixed practice, an internship, and most recently small animal practice, where I gained my certificate in small animal diagnostic imaging. This is my first IMV Imaging Journal Club presentation, so I hope you enjoy. So the paper that I've decided to present is one by Amy Ferreira and the other members of the Internal Medicine and Diagnostic Imaging departments at the University of Liverpool Small Animal Teaching Hospital, whereby they investigated the prevalence and the clinical significance of the medullary rim sign identified on ultrasound of feline kidneys. This paper was submitted in 2019 and was published in the Veterinary Record in May 2020. So, introduction. What is a medullary rim sign? It's occasionally seen on ultrasonographic examination of the kidneys, commonly defined as a distinct hyperechoic zone in the outer renal medulla, forming this curved linear band which is parallel to the cortical medullary junction. It doesn't cast an acoustic shadow. However, some observations in practice have revealed the rim sign can appear discontinuous with variable echogenicity and thickness. Currently, there are conflicting views as some recent publications have not found an association between the medullary rim sign and renal disease in cats. However, other authors have considered the medullary rim sign an abnormal ultrasound feature of feline kidneys, but clinical significance still remains unknown. The medullary rim sign has been described in not just cats, but dogs and humans too. So this slide just shows possible etiologies for both cats and dogs separately and shared as previously reported. In cases where the medullary rim sign has been reported with supportive histopathology in cats, diagnoses have included feline infectious peritonitis, chronic interstitial nephritis, and acute tubular necrosis secondary to ethylene glycol toxicity. Similarly, in dogs, there is an uncertainty surrounding the clinical significance of the medullary rim sign. However, changes compatible or similar to the medullary rim sign have been reported in dogs with hypercalcemic nephropathy, ethylene glycol toxicity, and leptospirosis. The shared possible etiologies were reported following histopathology on a limited number of cases of dogs and cats with rim-like changes in the medulla echogenicity. These included intraluminal mineral deposits, necrotizing pyogranulomatous vasculitis, tubular necrosis, calcium and calcium oxalate crystal deposition, metastatic calcification of the renal tubular epithelium, and acute tubular necrosis. So the objectives of this study were to, 1, determine the prevalence of the medullary rim sign in a referral hospital population of feline patients undergoing ultrasound examination, and 2, determine if the medullary rim sign or its specific features are associated with renal disease or a specific final diagnosis by comparing them with a time-matched control population. The null hypothesis in this study, although I haven't noted it, was that cats with a medullary rim sign have a similar frequency of renal disease compared to those without medullary rim sign. This was a retrospective case control study using the electronic database at the Small Animal Teaching Hospital. Cats which underwent an abdominal ultrasound examination between November 2010 and August 2016 were included, totaling 661 cats in the initial study group. Ultrasound images of both kidneys and an ultrasound report were reviewed retrospectively by one author, Amy Ferreira, and for each cat identified with a medullary rim sign in the initial study group, a time-matched control cat was assigned and included in the control group. This was done by selecting the next cat closest in time that had received an abdominal ultrasound, met the inclusion criteria, and did not have a medullary rim sign. Each cat was only included once in the study, even if they'd received multiple ultrasound examinations, and it was only the first exam which was included. Cats were excluded from the study if there was a history, ultrasound evidence, or a final diagnosis of urinary tract obstruction, renal lifts, or urethral lifts at the time of the study inclusion. This was in an attempt to exclude any cases of post-renal azotemia. Data collected from medical records when available included age, sex, breed, body weight, serum urea and creatinine levels, urine-specific gravity or USG, urine protein-creatinine ratio, serum total calcium, serum ionized calcium, urinalysis abnormalities, the presence of cardiac disease or systemic hypertension, renal diagnosis, and then the final diagnosis. It's important to bear in mind azotemia was defined as serum urea and creatinine levels above normal laboratory reference ranges. And for this study, renal disease was classified using the International Renal Interest Society, or IRIS classification as we know it, for chronic kidney disease based on stable serum creatinine values present in the presence of persistent structural or functional renal abnormalities. Cases with an IRIS stage 2 chronic kidney disease or above were considered representative of azotemic renal disease for this study. The ultrasound examinations were performed using several different ultrasound machines over a study period, and either a multi-frequency microconvex or linear transducer was used for the examination as per hospital protocol. All abdominal ultrasound examinations were completed by a board-certified radiologist or by a resident under the direct supervision of a board-certified radiologist. The ultrasound features of the medullary rim sign were assessed and noted. When present bilaterally, the medullary rim sign symmetry between the left and right kidneys was assessed with respect to the intensity, thickness, and completeness. Looking at the figure for reference, the medullary intensity was subjectively characterized relative to the echogenicity of the renal cortex as either mild, so hyperechoic, which is displayed in pictures A and D, moderate, isoechoic in pictures B and E, or marked hyperechoic in pictures C and F. The width of the medullary rim sign was characterized as thin if it measured less than 2.5 millimeters, which is the top line of images, and thick if it measured at least 2.5 millimeters, which is the lower line of images. And then the medullary rim sign was finally characterized as a complete if the rim light changes were present in the entire medulla, or incomplete if the changes were discontinuous and not present in all areas of the medulla. Before I continue, I'll pre-warn that the next few slides are rather text-heavy. So all statistical analysis for this study was conducted using commercial statistical software. Independent variables were derived from information obtained from the signalment data, patient records, ultrasound images, and reports. Descriptive statistics were produced for all variables. Continuous data was summarised as medians with interquartile ranges, or IQRs, and categorical data as frequencies with a 95% confidence interval. For continuous variables such as age and weight, normality was evaluated using graphical assessment and via the Kolmogorov-Smirnov test. Differences in weight and age for medullary rim sign cats and controlled was evaluated using the Mann-Whitney-U test. And differences in the proportions of breeds and sexes between the groups were assessed using the chi-squared test. So exact conditional logistic regression was used to test for any associations between the presence of a medullary rim sign and all collected independent variables. Unconditional logistic regression was used to test for associations between the presence of azotemic renal disease and renal ultrasound findings. From this, for both analyses, any variables which showed some association with their respective outcomes were considered for incorporation into a multivariable model, and then any variables with a p-number less than 0.05 were considered significant for all analyses. So on to the results. Of the 661 cats who had their abdominal ultrasound images reviewed, 243 cats demonstrated a medullary rim sign, giving an overall prevalence of 36.8% in this population. Medical records were retrieved from all 243 cats with a medullary rim sign and from 243 time-matched control cats. There were 300 males, 275 which were neutered, and 186 females, again 176 which were neutered, and the median age was 8.1 years, ranging from 0.25 to 20.1. The median body weight was 3.9 kilos, ranging from 1.3 to 7.9. There were 304 domestic short hairs, 26 domestic long hairs, 24 British short hairs, 23 Siamese, 19 Bengals, 18 Ragdolls, 13 Maine Coons, 13 Persians, 9 Burmese, 9 Orientals, and 8 Burmans, and then 20 other cats, which represented 11 other feline breeds, but each had fewer than 5 individuals in each. So comparisons between the medullary rim sign and control cats revealed there was no difference between breed, age, and body weight. However, a statistically significant difference in the sex distribution between the two groups was identified, as highlighted on the table, which shows a p-value of 0.003. The results of the medical data showed no significant associations with regard to proteinuria, hypercalcemia, or azotemia between the groups. Additionally, there was no association detected in regards to the severity or the classification of azotemia between the groups. There was a significant association detected between the presence of a medullary rim sign and azotemic renal disease, iris stage 2 as stated by the medical records, and a final diagnosis of FIP. Then on multivariable conditional logistic regression, analysis only showed that azotemic renal disease and a final diagnosis of FIP remained statistically significant between the groups. On a side note, focusing on the FIP cats, a final diagnosis was made in 23 cats, 15 who were in the medullary rim sign group and 8 which were in the control group. In the FIP cats, with a medullary rim sign, 80% of those had a thin medullary rim sign on examination, and then 53% of those had a medullary rim sign of marked intensity. The kidneys were otherwise ultrasonographically normal in 16 of the FIP positive cats, abnormal in 7, 3 of which had reduced cortical medullary definition, and 4 with a hypoechoic subcapsular rim. None of the FIP cats had azotemic renal disease as defined by the study from their medical records. The ultrasound features following univariable unconditional logistic regression showed that medullary rim sign thickness, i.e. a thick band, medullary rim sign intensity, moderate intensity, completeness, i.e. complete rim, and additional renal ultrasound findings, those consistent with chronic kidney disease, were associated with azotemic renal disease. However, then incorporating into multivariable analysis, only a thick medullary rim sign and ultrasound findings consistent with chronic kidney disease were significantly associated with azotemic renal disease. Moving on from this, the medullary rim sign was found to be bilateral and symmetrical in all but 4 cats. Those 4 cats were all found to have one grossly abnormal kidney, which was secondary to unidentifiable causes. More than one ultrasound examination was performed in 44 of the cats with a medullary rim sign. The median number of scans was 2, with a range of 2 to 11. The time interval between subsequent scans was highly variable, with a median of 171 days, but the actual range was from 3 to over 2,000 days in between. Despite the range, it was found that the features of the medullary rim sign did not change in subjective assessment over time in any of the 44 cats. From the results, the initial associations that can be made are a thin medullary rim sign, which was found in 133 cats, did not appear to be associated with azotemic renal disease. A thick medullary rim sign, which was identified in 110 cats, appeared to be associated with azotemic renal disease, and there appeared to be an association between the presence of a medullary rim sign and the final diagnosis of feline infectious peritonitis. From this study, it was concluded that the medullary rim sign was a common finding in their cat population, with a prevalence of 36.8%. This was similar to previous reports by Jaeger and Anderson in 1989, who reported a 30% prevalence in their study, although interestingly, in more recent breed-specific studies, lower prevalence estimates have been reported. Evaluation of the specific features revealed that the medullary rim sign is often bilateral and symmetrical, and in this current study, there was no indication of breed predilection. Furthermore, the presence of a medullary rim sign was associated with azotemic renal disease, leading the study to reject its null hypothesis. Of the medullary rim sign features investigated in this study, thickness was the only feature identified as a potentially significant ultrasound characteristic. The authors weren't surprised by this, and although there was no supportive histopathology for any of the thin medullary rim sign cases in the present study, it is speculated that a thin medullary rim sign likely represents tubular intraluminal deposits as previously described by Jaeger and Anderson. This may then suggest that a thin and thick medullary rim sign represent different disease processes. However, inconsistencies with other studies, notably Mantis and Lamb, suggest that changes in renal echogenicity should always be interpreted with caution when found in isolation. Further to this, future investigations into the medullary rim sign and its features would require a prospective study that objectively measured the thickness of the medullary rim sign under standardized conditions, as well as collecting specified clinical data and that supportive histopathology. In the present study, only a limited number of cases with a medullary rim sign had repeat ultrasound scans over a highly variable time period, and subjective appearance of the medullary rim sign was found not to change over time. This is consistent with what has been reported in dogs and humans. However, due to the high variability, no firm conclusions can be drawn regarding the potential change in the medullary rim sign over time from this present study, and as a result, future investigations are required to establish this. An association between the medullary rim sign and a final diagnosis of FIP was made, where a thin, marked intensity medullary rim sign was frequently identified. Interestingly, in previous reports describing the ultrasound appearance of kidneys in cats with FIP, they have documented that a thin medullary rim sign with a marked intensity was present, which was then subsequently found to be caused by pyogranulomatous vasculitis on histopathology. Therefore, in clinical cases where there is a suspicion of FIP, the medullary rim sign may not be an incidental finding. Furthermore, there was no statistically significant association between the medullary rim sign and hypercalcemia in this study, which is interesting, as from possible etiologies you may assume a link. However, the absence of documented total hypercalcemia doesn't exclude possible previous episodes or an ionized hypercalcemia. And as you may have noticed, there was an overrepresentation of males in this study, 300 males to 186 females, with a slight overrepresentation within the medullary rim group. However, it was not considered by the authors large enough to create the statistical significance that has been seen. So, limitations. The first limitation is mostly related to the retrospective nature and method of data collection, as a variety of machines, ultrasound transducers, and operators were used to obtain the images, and this would have introduced uncontrolled variability within the dataset. However, by having a time-matched control cases, this will have counteracted it to some degree. Furthermore, by having assessment and measurement of the ultrasound images only performed by one observer, again, there is a risk of introducing operator error here. And another point, when the ultrasound images and reports were reviewed, if an abnormality was not seen or reported, it was considered absent, and therefore this raises the potential for false negatives where an abnormality may have been present but was not reported. In addition, as none of the medullary rim sign cases had histopathology, the underlying etiology can only be speculated and not confirmed. And furthermore, all of the data points were not obtained for every cat because biochemical tests were performed at the discretion of the attending clinician at the time of examination. And then as a result, data extraction is therefore limited by the completeness of the medical records, so not all individuals will have had exactly the same data input. Moving on, the study population was limited to a single referral hospital population, and as a result is highly selective and biased. Therefore, the true prevalence of the medullary rim sign in the general feline population remains unknown. As seen in previous slides, there was a number of statistical tests which were carried out with multiple comparisons, which increases the risk of type 1 statistical error. In an attempt to mitigate this, the study did only select variables where there was an expectation of possible association. However, the possibility that some associations identified could be false positives should always be considered. And then last but not least, the statistical significance sex difference was most likely due to the low numbers of intact females within the study population, with a marked uneven distribution between the medullary rim sign group, which had 8 individuals, and control cases, which had 2 individuals, thus creating a statistical bias. So, in conclusion, this paper appears to further support that a thin medullary rim sign is a non-specific finding in cats and most likely incidental. A thick medullary rim sign was found to be associated with azotemic renal disease and may represent a different pathological process to that of a thin medullary rim sign. An ongoing association between the presence of a medullary rim sign and a final diagnosis of FIP was seen, and therefore could be considered a supportive finding when there is a clinical suspicion of FIP present. Further investigation is required along with histopathology to determine the true prevalence and the association of the medullary rim sign with renal disease in the general feline population. Well, thank you for joining me for this month's Journal Club. I hope you found it interesting and may even be able to make use of the study's findings in your next ultrasound examinations. Goodbye.